In this video, we will analyze genetic and genomic considerations in pharmacotherapeutics. Leading healthcare organizations have emphasized the necessity for enhanced education in genomics and pharmacogenomics to enhance patient outcomes. Healthcare professionals should receive comprehensive genomics education, encompassing patient counseling, genetic test interpretation, and optimization of pharmacological therapies. The completion of the human genome sequencing in 2003 marked a watershed moment in medical science. Collins and McKusick, 2001. Since this milestone achievement, patients have benefited from remarkable advancements in genomic science and technology. Before delving deeper into pharmacogenomics, it is beneficial to distinguish between genetics and genomics. The field of genetics has existed since Gregor Mendel's groundbreaking work with pea plants in the 19th century. Genetics examines the transmission of hereditary traits across generations through human genes and studies how genes function through protein synthesis. Research has demonstrated that individuals with identical genes may manifest different diseases or varying expressions of disease characteristics. According to the National Human Genome Research Institute, the genome encompasses all genes within an organism. Genomics refers to the comprehensive study of the genome and gene interactions with each other and environmental factors. Green et al., 2020. Genomic investigation frequently focuses on conditions such as asthma, cardiovascular disease, and cancer, as these disorders often result from complex interactions between an individual's genome and their unique environment. The discipline of human genomics encompasses numerous scientific domains, including epigenomics, proteomics, microbiomics, and pharmacogenomics. How does genomics fundamentally differ from genetics? As research has revealed, patients with identical genetic profiles may experience different diseases or varying manifestations of disease traits. This phenomenon stems from variations in environmental exposure, nutritional patterns, sleep duration, occupational factors, and numerous other variables. Genomics incorporates an individual's environmental context and lifestyle factors into its analytical framework. The National Institutes of Health characterizes pharmacogenomics as the investigation of how genetic factors influence an individual's response to medications. Pharmacogenomics aims to integrate genomic science with pharmacology to deliver individualized, targeted, and safe pharmacological interventions to patients. While some may categorize pharmacogenomics within personalized medicine or precision medicine, pharmacogenomics more accurately falls under the precision medicine umbrella. Although these terms are frequently used interchangeably, precision medicine denotes a broader approach to identifying effective treatment strategies for similar patient cohorts with specific genetic, lifestyle, and environmental characteristics. The terminology precision medicine evolved from the concept of personalized medicine. The term personalized medicine has become less favored because while healthcare providers treat patients individually, researchers are not developing novel treatments for every person globally. Despite being a relatively nascent field, pharmacogenomics has generated significant clinically relevant information, data that can be utilized to amplify therapeutic efficacy and minimize harm. A patient's distinctive genetic composition can result in drug responses that differ qualitatively and quantitatively from those observed in the general population. Therapeutic effects and adverse reactions may be enhanced or diminished. Idiosyncratic drug responses may also occur. Identification of genetic variations among individuals enables prescribers to select more appropriate medications for patients. According to the U.S. Food and Drug Administration, adverse drug reactions constitute the fourth leading cause of mortality in the United States, with over 100,000 fatalities and 2 million serious adverse drug events annually. Consequently, the FDA has incorporated pharmacogenomic biomarkers in the package inserts of more than 150 medications. Of these pharmaceuticals, 38 are mandated to include pharmacogenetic information in their package inserts. Genetic testing is now routinely conducted for certain medications. For some drugs, such as Maraviroc, also known as Selzentry, and Trastuzumab, also called Herceptin, the FDA now mandates genetic testing prior to administration. For others, including warfarin, known as Coumadin and carbamazepine or Tegretol, genetic testing is recommended but not required. Prominent healthcare organizations have voiced the necessity for additional education in genomics and pharmacogenomics to improve patient outcomes. In their 2015 publication, Improving Genetics Education in Graduate and Continuing Health Professional Education, the National Academy of Medicine, formerly the Institute of Medicine, advocated that genomics education should be provided for all health professionals. Practitioners should possess expertise in patient education, genetic testing interpretation, and management of appropriate drug therapies. In September 2011, the American Nurses Association, or ANA, published Essential Genetic and Genomic Competencies for Nurses with Graduate Degrees. This document outlined 38 competencies for nurses in the domains of risk assessment and interpretation, genetic education, clinical management, and ethical, legal, and social implications. Greco et al., 2012. Additional strong advocates for genomics education and application include the National Institute of Nursing Research, or NINR, and the American Academy of Physician Assistants, AAPA. The Society of PAs in Genetics and Genomics, also known as SPAG, represents a significant interest group affiliated with AAPA. In pharmacogenomics, testing is conducted for genetic characteristics related to drug responses, also known as biomarkers. The technical definition of a biomarker is a quantifiable substance that, when present in an organism, indicates the existence of a specific phenomenon. In simpler terms, a biomarker informs practitioners about the presence of genetic variation. Biomarkers are utilized not only to diagnose certain disease processes, but also in pharmacogenomics to determine responses to pharmacological interventions. Relling and Evans, 2015. The most prevalent mechanism through which genetic variants modify drug responses is by altering drug metabolism. These genetically based changes can either accelerate or decelerate the metabolism of numerous medications. The typical consequence is either diminished benefits or increased toxicity. For medications with a high therapeutic index, altered metabolism rates may minimally impact clinical outcomes. However, if the therapeutic index is low or narrow, then relatively small increases in drug concentrations can result in toxicity, and relatively small decreases in drug levels can lead to therapeutic failure. In these scenarios, altered metabolism rates can be significant. Variants in the gene encoding CYP2C9 can heighten the risk for toxicity from warfarin, an anticoagulant with a narrow therapeutic index. Hemorrhage occurs because first, warfarin is inactivated by CYP2C9, and second, patients with altered CYP2C9 genes produce an enzyme form that metabolizes warfarin slowly, allowing its accumulation to hazardous levels. To reduce bleeding risk, the FDA now recommends testing patients for CYP2C9 gene variants. Variants in the gene encoding thiopurine methyltransferase, or TPMT, can reduce TPMT activity, thereby delaying the metabolic inactivation of two thiopurine anti-cancer drugs, theoguanine and mercaptopurine, also known as purinethol. Consequently, in patients with inherited TPMT deficiency, standard doses of theoguanine or mercaptopurine can accumulate to elevated levels, posing a risk for potentially fatal bone marrow suppression. To mitigate this risk, the FDA recommends testing for TPMT variants before administering either medication. Genetic variations can alter the structure of drug receptors and other target molecules, thereby influencing drug responses. These variants have been documented in normal cells, cancer cells, and viruses, according to Whirl-Carrillo and colleagues in 2012. Trastuzumab, also known as Herceptin, is utilized for breast cancer treatment and is only effective against tumors that overexpress human epidermal growth factor receptor type 2, or HER2. The HER2 protein, which functions as a receptor for hormones that stimulate tumor growth, is overexpressed in approximately 25% of breast cancer patients. HER2 overexpression is associated with poor prognosis but also predicts an enhanced response to trastuzumab. Accordingly, the FDA requires confirmation of HER2 overexpression before trastuzumab administration. Cetuximab, also known as Erbitux, is primarily used for treating metastatic colorectal cancer. It's only effective against tumors that express the epidermal growth factor receptor, or EGFR. All other tumors, well, they are unresponsive. Consequently, the FDA requires evidence of EGFR expression for the drug's utilization. Genetic variants affecting the immune system can increase the risk for severe hypersensitivity reactions to certain medications, as noted by Carnes and colleagues in 2020. Carbamazepine, commonly known as Tegretol, is used for epilepsy and bipolar disorder. However, it can cause life-threatening cutaneous reactions in some patients, especially those of Asian ancestry carrying genes that encode an unusual human leukocyte antigen, or HLA, known as HLA-B1502. Although the mechanism underlying this toxicity remains unclear, it is hypothesized that interactions between HLA-B1502 molecules and carbamazepine, or its metabolite, may trigger a cellular immune response. To reduce this risk, the FDA recommends screening patients of Asian descent for the HLA-B*1502 gene before administering carbamazepine. Abacavir, also known as Xiagen, is used for HIV infection. However, it can cause potentially fatal hypersensitivity reactions in patients possessing a variant gene that encodes HLA-B*5701. Accordingly, the FDA recommends screening for this variant gene before utilizing this medication. To perform comprehensive testing, providers must have access to facilities approved for accurate laboratory analysis of genetic biomarkers. Blood, saliva, urine, amniotic fluid, tissue, or hair may be utilized, depending on test requirements. Due to explosive growth in research and technology, over 70,000 genetic testing products are currently available in the United States market, with approximately 10 new products entering daily. Many tests are now available in panel format, allowing assessment of multiple biomarkers with a single sample. As pharmacogenomics represents a relatively new and rapidly evolving science, many healthcare providers lack the knowledge or confidence to order or interpret testing. Additionally, patient education must be incorporated into treatment protocols. Provider education remains insufficient within graduate programs, despite pockets of valuable online resources. Many insurance plans do not cover genetic testing as a preventive option. As precision medicine gains prominence, more insurance companies are beginning to cover all or part of certain tests, especially when recommended by providers. Costs for genetic tests range from $100 to $2,000 depending on test complexity or panel comprehensiveness. Patients require full disclosure regarding testing implications before undergoing evaluation. Providers must obtain informed consent and educate patients on testing rationale, potential results, and treatment options based on outcomes. Patient confidentiality must be maintained with genetic information, as with all medical information shared between provider and patient. Few clinical guidelines exist in pharmacogenomics due to its relative novelty. Currently, the Clinical Pharmacogenetics Implementation Consortium, or CPIC, provides the most extensive guidelines for clinical practice. As of 2018, CPIC had published 35 guidelines on individual medications including codeine, warfarin, clopidogrel, allopurinol, and others. The Royal Dutch Association for the Advancement of Pharmacy Pharmacogenetics Working Group, or DPWG, and the Canadian Pharmacogenomics Network for Drug Safety, also known as CPNDs, have published clinical practice recommendations regarding pharmacotherapy in patients with genetic variations. In the future, pharmacogenomic analysis of individual patients may enable revolutionary personalized medicine addressing individual genotypes. Currently, while significant advances have occurred in pharmacogenomic knowledge, the science remains relatively nascent. Please refer to the description for more information.